when you're in labor, the cervix will start to open. Now, normally your cervix looks like this. It's this tubular thing. Okay, this is the cervix. If you can see the cursor. Okay, so it's a tubular thing. Now, when you labor, what happens is that this cervix will start to shorten. Okay, until it becomes very thin, and that's what we call effaced. And then it will start to open up. And then that's the dilatation that we check. When you're fully dilated, means that when the doctor or the nurse puts the finger in the vagina, they can't feel any part of the cervix anymore. That means it's fully dilated. And usually it does correspond to about 10 centimeters, because that's the rough diameter of that pelvic space. Okay. So how long does a labor normally take? This is the cervical dilatation. So you see, from about 3 cm, right, to about 3 cm, that phase can be very long. That's why the initial part where you're waiting out for the contractions to happen or the cervix to dilate, which you would not know, of course, it can be very long, a few hours to even half a day or a whole day. Okay. Then once it gets to 3 cm and the contractions start to get more regular, you find that the pace in which the labor happens tend to be more it tends to be faster already. And for women who are in the first pregnancy, it roughly corresponds to 1 cm per hour. Okay, so you come in at 3 cm, it's still like 7-8 hours more to go. But for women who have delivered, sometimes the point where you're 3 cm to 10 cm can happen suddenly over a space of 1 hour or even half an hour. So I normally would advise women who have delivered before not to drag things too long. Once the contractions are regular every 5 to 8 minutes, before it gets very painful, just go into the hospital, because once it gets very painful, it can be really very fast. Okay, and I guess you rather be in the hospital longer than to deliver in a taxi or at home, because that can be quite traumatic. Okay,